In today's Mental Health Monday, we are talking about the Black community, particularly the history of systemic racism here in the U.S., in the mental health system, and how it harms Black communities everywhere. Here to explain a little bit more is licensed therapist Dr. Sheryl Ziegler. Dr. Ziegler, thanks so much for coming in and talking about this.
I'm happy to be here.
Now, this is a complex issue that we were just talking about because it goes back centuries.
It does. It's really, it takes your breath almost away when you see how this unfolded. But really what happened in 1840, they decided they were going to ask about mental health for the first time. So these U.S. Marshals went around and they were looking to ask questions specifically for freed and then unfreed African Americans. So slaves and then people who were free. And somehow what they concluded was that the African Americans who had been freed were insane and feeble-minded. They called them idiots. And so this was used for propaganda that African Americans shouldn't be freed, because if they were freed, then they would just become insane and they weren't able to make rational choices. And this has lasted for well over a century, this kind of thinking.
Were you mind blown, like when you were researching this? Were you just thinking this is wild?
Yes, and while you're getting trained to be a psychologist, you learn about institutionalization, which was a result of this. You learn about that history, but for me personally, I hadn't learned about African Americans, about immigrants, and how that specifically affected them. So yes, even for me, it sort of took my breath away.
Well, and what breaks my heart about this is, you know, there are so many people who, to this day, fighting systemic racism at different levels. Does this persist anywhere that we're seeing today? I mean, is this something that, unfortunately, this mindset that, like, to us seems shocking, does that persist in certain circles? I
mean, I can just speak from my world. In terms of mental health, there really was a thought not that long ago where there was a belief that maybe African Americans just didn't have the genetics to have high intellectual capabilities. So that did persist for a very long time, that notion of idiots. And so that's something that's persisted. And I think, you know, even when we look at the NFL, we look at the Super Bowl and what a big deal it was to have two Black quarterbacks. Right? The thought was, you know, maybe African Americans aren't bright enough to be a quarterback. That was part of that systemic racism. Even there was, you know, they're better suited for maybe different roles. So whether you're looking at sports, whether you're looking at intellect, classroom, educational systems, absolutely this has had lasting impacts.
This is such a bittersweet thing because we need to know about this. This is how we're going to correct, you know, any wrongdoings from the past. Is we have to know that it exists, but it breaks your heart to know, like you mentioned, the Super Bowl. On one hand, we wanted to celebrate that there were two Black quarterbacks. On the other hand, we thought, how sad, 2023, and we're still celebrating things like this.
Absolutely. And I think, you know, in terms of mental health, how that impact is still absolutely today is African Americans are 4 times more likely to be diagnosed with schizophrenia. They're less likely to be diagnosed with mood disorders. They have disproportionate, you know, representation in juvenile systems and in penitentiaries and prison systems. They have less access to mental health. They're more likely, just like the segment before, they're more likely to also discontinue treatment earlier because maybe they don't feel that it's culturally sensitive. There aren't people that look like them that are treating them to understand them. So we have still huge problems. When we have 5% or even less of psychologists who are African American, we have a long way to go to get the right treatment to these people who have for over a century, well over a century, not received the health care that they really deserve.
And just really quickly, because we are out of time, but are we seeing that work happening now to go, you know, back and try to correct this?
I think in some small ways, you know, I think having these kinds of conversations are really important. But in general, in health, in the healthcare world, I think the tide is turning where we're just starting to pay attention to what we need to do. But we have a long way to go.
Yeah. All right. Well, Dr. Ziegler, thanks for bringing this to our forefront. We appreciate it.
Thanks for having me.